Welcome to our very special show, Health and Wellness, Myths and Facts. I'm Ambika Singh Kama. A few weeks back, it seemed that the COVID pandemic was in its last stages and we were hopeful that it will end soon. But the emergence of Omicron has thrown all our projections of 2022 into disarray. Even though we have a variant which causes a mild infection, it can affect the vulnerable and the people who have not received the booster dose. Due to Omicron's high rate of transmission and danger to unvaccinated and people with comorbidities, hospitalizations could rise in the coming months. People with chronic diseases should be more careful about the management of their conditions during this phase. Chronic diseases are the major cause of death and disability worldwide. The total number of people dying from chronic diseases is double that of people succumbing due to infectious diseases. The two most common and leading causes of death are diabetes and heart disease. Altered lifestyle is a common risk factor in all major chronic diseases. With the pandemic, chronic diseases are also on the rise. People are increasingly turning to social media for health information, which may not always be reliable. Advice from our experts will help our viewers get medically correct and actionable information so that they can act accordingly. So if you have any questions you would like to ask them, please send them to us via WhatsApp to the number. The number is +91 9167 666 941. Please also send in your name and your location along with your questions. Let me introduce our guests. We have with us Dr. Amitabh Khanna, Head Diabetology, Meteor Hospital, Dwarka, and Director, Diabetes Specialty Center, Delhi. And we also have with us Dr. D K Baruah, MBBS, MD, General Medicine, Interventional Cardiologist, Director of Cardiac Catheterization Lab and Invasive Cardiology, Apollo Hospitals, Visakhapatnam. Thank you all so much, doctors, for joining us today. I would like to start with you first, Dr. Khanna. Is there any data on the time gap for the reinfection by the Omicron variant among those vaccinated? And can a person who has been vaccinated be infected by COVID soon after vaccination?
Okay. At present, there is no data about this thing, that after how many days of vaccination, the person can get infected with Omicron variant. And if I talk about real world, in our practice, we have seen that even immediately after vaccination, we saw positive cases for Omicron. But here I will like to emphasize one thing, that vaccination is very essential and everybody should get vaccinated with both the doses. And what is seen that the persons who were vaccinated got the milder form of the disease and very slight symptoms. So one should get vaccinated. And in a study in the University of California, USA, it was seen the vaccinated persons, when they were infected with Omicron, the immunity level which they developed were much more than the persons who were not vaccinated. So vaccination is a must, but a person, of course, can get Omicron even immediately after vaccination.
Okay, but like you rightly said, Dr. Khanna, the severity is much less if a person is vaccinated. So, of course, vaccination is key, and of course, now the booster as well. Dr. Baruah, what is your opinion, the best treatment for Omicron, and do antibiotics really work?
Yeah, Omicron is an evolved virus, and it has acquired a highly transmissible rate after kind of mutation. I will say it is about 1.5 to 2 times more transmissible than Delta. At the same time, it has acquired a 2 to 3% increase capability to infect than Delta virus to fully vaccinated people as well as person who already had infection.
Okay. At
the same time, we know that whatever data we have, Omicron causes less severe infection, and at the same time we also know that from the South African study that hospitalized patient death rates are much lesser than the Delta infection.
Yes.
Having said that, we also know that most of our population in India either got vaccination or they might have exposed to COVID infection. So they have relatively, have some kind of resistance to this virus. So having said that, I think I should say the current Omicron infection cases can be managed by home isolation as well as with the proper rest and hydration. At the same time, I think we should be cautious that suppose patient continues to have cough or fever, and during the course of the disease he develop increasing breathlessness and of course less oxygen saturation. In that case, probably the person warrants hospitalization and for further advanced treatment.
Okay.
For the second part of your question, this regarding antibiotics in COVID, as all of us know that COVID is a viral disease, and any antibiotic against the virus infection is not effective.
Okay.
So at the same time, we understand that what are the treatment in first and second COVID waves, the accidental treatment like ivermectin, convalescent serum, then various antibiotics were used at that time, which are now proved to be ineffective.
Okay.
So having said, at the same time, I should say that a role of antibiotic is there when there is a secondary bacterial infection in a viral disease. So similarly, in a COVID or Omicron infection, suppose there is any evidences of secondary infection, maybe in that particular case, probably antibiotic can be used. Otherwise, there is no role of antibiotic per se in viral infection.
So thank you for explaining that, because I think it's very important to understand. No point just having antibiotic without really knowing why you need it. Moving on to diabetes, Dr. Khanna, type 2 diabetes is usually more common seen in middle-aged or older adults. But now there is a rise in cases of diabetes in the younger population as well. What are the factors which contribute to the development of type 2 diabetes in young people, and which category of young people are most at risk of developing type 2 diabetes?
Yeah, it's very true. Since last 1 or 2 decades, we are seeing more and more young patients are being diagnosed with type 2 diabetes. And the main factors which contribute to this is obesity. The overweight individuals are more prone to get diabetes. The sedentary lifestyle, consumption of more and more junk foods, more oils, and these things are lifestyle factors which are contributing to the younger generation being detected as diabetics. And also there are genetic factors. The persons having the parents or any first-line blood relative having diabetes are more prone to develop diabetes. So such persons with a strong family history of diabetes should be very cautious. They should keep their lifestyle good. They should not become overweight. They should do regular exercise and reduce the consumption of junk food. By these things, we can at least delay the onset of diabetes to a later decade of life.
So that's really well explained, that if genetics is the reason, then you need to be extra cautious. But like rightly said, I mean, sedentary lifestyle, junk food, these are some things one really must be careful of. Dr. Baruah, heart attack and cardiac diseases have remained a major health concern around the world. But it is only recently that a rising number of heart attacks among the younger population are being reported. What do you think could be the reason for this?
Yeah, this is a very excellent question in the perspective of especially Indian scenario. As you know, being young, it doesn't mean that somebody is resistant or immune to heart attack. Of late, we have been seeing a lot of youngsters are coming to our clinic with a lot of heart issues. And also we have noticed that what we used to see previously, this son used to bring parents with heart disease. Now we are seeing even parents bringing in sons with heart attack. So this is totally a kind of whole scenario changing. As you know, we have major risk factors for heart disease, as diabetes, as Dr. Khanna has told, diabetes and obesity, high cholesterol, hypertension, and kind of lack of exercise, sedentary life, and these are major risk factors which can cause heart disease. But when you really in the perspective of young heart disease, young heart attack, always we should consider something different, because apart from this, common risk factor like hypertension, obesity, and smoking, and any form of tobacco for that matter. And of course, one important thing is the premature coronary artery disease history in the family. Somebody who has a heart attack at 45 years or less than that. So all these are the common risk factors for any young person. Yeah. But at the same time, what are the newer risk factors? It is a lifestyle risk factor, I should say. Lack of exercise. There's an imbalance between your service as well as your lifestyle, and prolonged job, this inadequate sleep, and stress involved in the job in the place of job, and of course recreational drugs, which has become more common problem. More and more we have seen in different cities in India.
Yes.
And of course, very bad food habit, like junk foods. Mm-hmm. These are along with the excessive alcohol. These are different important upcoming risk factors which actually definitely contributing in the development of younger heart disease. I should say that this is the effect of the rapid urbanization in India. Mm-hmm. Then, of course, associated with the risk factor lifestyle changes for that matter, and combined with our lack of awareness of the heart disease in India, I think that is taking a lot of tolls in the younger heart attack.
Absolutely, like both of you said, Dr. Khanna and Dr. Baruah, it's about the lifestyle one has to maintain, I think that's really, really key, and especially for the youngsters, because whether it's diabetes or even the heart, it is really affecting them. Moving on, Dr. Khanna, there are some misconceptions regarding the levels of blood sugars that can diagnose diabetes. So which parameters need to be checked before confirming that a person has diabetes or he is diabetic?
Actually, the criteria for diagnosis of diabetes of different guidelines, if we say either WHO or International Diabetic Federation, they are almost same, and we go by that criteria only. So coming first to fasting blood sugar, if we check the fasting blood sugar and it is below 100, it is normal. Between 100 to 126, we call it as impaired fasting glucose, and above 126, we may diagnose as diabetes. And postprandial blood sugar or random blood sugar, if it is between 140 to 200, then we call it as pre-diabetic, and above 200, it's a diabetic patient. Also, there is one test which we call as HbA1c. Mm-hmm. HbA1c tells us last 3 months average sugar, and it's also very important for diagnosis of diabetes. If HbA1c is between 5.6 to 6.4, then we call it as pre-diabetes, and above 6.4 HbA1c is there, then we consider it as a diabetic patient.
Okay.
So usually we take fasting postprandial blood glucose and HbA1c, then we decide the patient is diabetic or no.
Okay.
And the criteria is same for all age group. Mm-hmm. Only in gestational diabetes, which is during pregnancy, the criteria is little different.
Okay.
In pregnancy diabetic, usually we do a GTP test, glucose tolerance test, mm-hmm. and there the criteria we take below 92 to take fasting sugar as normal, mm-hmm. above that as diabetic. Okay. And 1 hour after we check sugar, if it is above 180, then we consider as diabetic. And after 2 hours, if it is above 153, then we consider it as diabetic.
Okay, so thank you actually for explaining all these parameters really well. That will really help our viewers to really understand if they are diabetic or not, and what course of action to take. So on that note, we're going to be taking a really short break. We'll be right back. Welcome back. You're watching Health and Wellness Myths versus Facts. Dr. Baruah, is it true that a sudden cardiac arrest is subtle and bystanders may not notice that what has really happened or it even occurred? What is the most common reason for a sudden cardiac arrest?
Yeah, sudden cardiac arrest basically is a condition where heart stops beating, and because of that, there is cessation of blood flow to the vital organs and causing sudden loss of consciousness. If the person is not attended within minutes, death easily perceived. So this sudden cardiac death, basically, what exactly you are telling is a subtle. It is very unpredictable. It is difficult to kind of predict that that person is going to have a kind of sudden cardiac death. However, there are some people who can who can have some pre-monitoring symptoms like racing heartbeats, and they can have some kind of fainting attacks before exactly going for the faint. And there are some people they can just during the hours of that sudden cardiac arrest, they can develop some kind of chest pain, breathing difficulty, or some kind of nauseatic feeling. There are some people these symptoms can come preceding the sudden cardiac arrest. So in that case, probably we can have some idea. Otherwise, it is very subtle and difficult to understand that somebody is going for cardiac arrest.
Okay.
Basically, cardiac arrest is diagnosed after it happens. So that is the reason probably finding out the high risk subset in this cardiology or high risk subset of the patient and preventing cardiac arrest is the best kind of approach towards this problem.
Absolutely.
The reason behind actually sudden cardiac arrest is the ineffective contraction of the ventricle. Normally, ventricle contracts in an effective way like this. When the heart this heart started contracting very fast, like the irregular beating like this. In that case, there is no effective ejection from the left ventricle. And ventricle means lower chambers of the heart. There is no effective ejection to the circulation. And the resulting is the low perfusion or deficiency of perfusion to the vital organs and leading to sudden kind of loss of consciousness.
Okay.
So this is the basic mechanism exactly what happened. But why this happen? Why this is called ventricular fibrillation? Why it happens? The commonest cause of this ventricular fibrillation of the coronary artery disease, what we say, disease leading to heart attack. That means when there is a blood supply to the heart is a muscle basically needs a blood supply, and nutrition comes through the blood supply, and there is some arteries supplying blood to the heart. So if there is any block in the arteries, gradually there will be deficiency of the oxygen to the muscle, and if suppose there is a total cutoff of this blood supply, person is going to heart attack. Okay. So heart attack leads to during that type itself that produce a lot of rhythm problem or the heart beating problem. And subsequently there is damage to the heart. It can produce again similar problem like heart beating problem, heart failure. So this is the reason why person develops sudden cardiac arrest. So this is a common reason. However, in a younger generation, like 30 years, 35 years, we do see some other reasons like cardiomyopathy, what is called muscle disease of the heart, which is more common. All of us have heard that athletes who is healthy suddenly have suddenly collapse in the field. So those cases actually cardiomyopathy, which is a muscle disease of the heart, which can be congenital, which can be acquired because of the alcohol and some other drugs, and that can produce sometimes this kind of ventricular fibrillation suddenly, and that can produce sudden cardiac arrest. Okay. So this is very, very important, and I think sudden cardiac arrest is suddenly it comes without any proper warning. So best way to approach is find out the high risk group of patient and prevent the cardiac arrest. This is the best treatment for this particular problem.
Absolutely, like you rightly explained, Dr. Baruah, it's most important to prevent it well before it really happens because one doesn't get to know. We have a WhatsApp question from our viewers, Dr. Khanna. In fact, it's a very interesting question. What is the best edible oil for diabetics? Is mustard oil good for diabetics? This question is from Vinay Singh from Ghaziabad.
Okay, the first part of question, which is the best oil for diabetic. So there is no such oil which is good for diabetic or best in diabetic, because diabetes, as we know, is a risk factor for heart disease also. So everyone should restrict the amount of oil they are taking, which is very essential. The total amount of oil should be restricted. And the amount varies from person to person and from different things, their other status, their cholesterol, their many things. But usually we advise 500 ml or half liter oil in a month one should consume. And there are many oils which are good and can be used, like olive oil, canola oil, flaxseed oil, rice bran oil. These all oils can be used.
Absolutely.
And,
Thank you. Thank you for explaining that. In fact, Dr. Baruah and Dr. Khanna, it's been really interesting. Thanks for sharing your expertise with us and our viewers. So we're going to be taking a really short break. We'll be back. News will continue on the other side. Thanks for watching.